And I think there's a very unfortunate phrase that's been going around in the media, particularly recently, which is toxic masculinity. And I don't like that phrase. I don't think we should use it because it implies that there's something almost inherently wrong with men. And I think that's not helpful. I think we have to have a much more positive approach. But I think when men are doing things that are good and positive, we have to acknowledge that as well.
As this is Men's Health Week, I want to draw attention to what I consider to be the two biggest obstacles faced by public policy makers when seeking to identify and promote healthy, holistic and effective solutions to negative health outcomes disproportionately impacting on boys and men. And to do this most effectively, I invite you to consider some excerpts from a recent panel discussion about men's health, hosted by none other than the World Health Organization. Agencies of the United Nations, like the WHO, can obviously have a massive influence on public policy matters. And as we all recently discovered, according to political leaders, policy makers and human rights watchdogs alike, the words according to the World Health Organization, can be used to help justify extremely controversial policy decisions like countrywide lockdowns that, according to representatives from the WHO, can be extremely detrimental to our health. For that reason alone, I'm not going to shy away from criticism where criticism is entirely constructive and valid, but I also want to emphasize from the outset that there are more than plenty of positives to be found when considering this particular discussion about men's health.
We know that basically in almost every country, men have higher rates of premature mortality than women. And we really are trying to understand why those things are. And it's not only due to individual health behaviors, but also due to a lack of attention from both a policy and programmatic standpoint in addressing these issues at a larger level, or even building the body of educators who actually focus on these types of issues.
So, firstly, kudos to Dr. John Barry from the Centre for Male Psychology, not just for bringing this discussion to our attention, but as you're about to hear, also for making the difference that makes all the difference to the direction of travel for this particular conversation about long-standing global health trends negatively impacting on boys and men. I'll leave a link to the entire discussion, which I would encourage you to listen to in full, because as I've already mentioned, overall I found it to be an extremely positive and encouraging discussion about what public policy makers can do to better address the matter of men's health. That being said, the purpose of this short video is to focus on a few brief excerpts that I believe effectively help to highlight two of the biggest obstacles public policy makers can currently be confronted with when seeking to identify and promote effective and holistic solutions to this issue. The first of which is one that has long since been widely recognised as a major challenge, frequently encountered by legislators, policymakers and champions of equality alike, and something that we can all be guilty of from time to time, specifically stereotyping. For the uninitiated, social psychologists describe stereotypes as a generalised belief about a particular category of people, leading to an expectation that people might have about every person in that particular group. The type of exception can vary. It can be, for example, an expectation about personality, preferences, appearance, or ability. And while stereotypes are generally found to be overgeneralized, inaccurate, and resistant to new information, it is relevant to note that they can, at least to some extent, sometimes be reasonably accurate. Consequently, while such generalizations can be useful when, for example, making quick decisions, they can also be extremely erroneous when applied to particular individuals, and are therefore among the primary causes of prejudicial attitudes. Meanwhile, the United Nations, no less, define gender stereotypes as a generalized view or preconception about attributes, characteristics, or roles that are or ought to be possessed or performed by women and men. Gender stereotyping refers to the practice of ascribing to an individual specific attributes, characteristics, or roles by reason only of their particular sex. And gender stereotyping can of course be extremely dangerous when it results in violations of human rights. So, with all that in mind, listen carefully to this short excerpt and see if you can spot any specific examples of gender stereotyping.
My name is Evelyn Boymena. I am a gender technical officer in WHO, specifically in the Gender Equity and Human Rights Department. And why men's health matters is because we are all affected by gender norms that expose us to different health risks. And it's important that we also take a look at how gender norms, roles, and relations, including those related to rigid notions of masculinity, affect the health and well-being of boys and men, and also, in extension, women, children, families, and communities. For example, gender norms that also contribute to boys and men, using violence to solve disagreements or issues, perpetrates violence then also against women and girls, and contribute to violence perpetrated against men, including homicide, youth and gang violence, which are among leading causes of morbidity and mortality among young men.
Now, hopefully you will have recognised at least one or two sweeping stereotypical statements ascribing specifically negative attributes and characteristics to men and boys of all colours, creeds and cultures from all around the world. But in fairness to the gender equity expert who was invited to share her expertise on the matter of men's health, I think it's only fair that I take a moment to point to 4 specific reasons why it would be unfair to unreasonably single her out for individual criticism, despite the fact that we have just heard her share such a negative, sweeping and stereotypical perspective about half the human race. To begin with, none of the other panel members initially disagreed with that perspective, and as we've already established, at least to some extent, stereotypes can sometimes be reasonably accurate, at least to some extent. And at the end of the day, the WHO's nominated gender equity expert witness was simply doing her job, with that specific job being to be a member of the Gender Equity and Human Rights team, who are tasked with coordinating the mainstreaming of gender equity approaches in health at all levels of the WHO. And realistically, as the content of their website clearly indicates, the day-to-day tasks of that department more generally involve coordinating the mainstreaming of gender equity approaches in health at all levels of the WHO, as they apply to the generally binary concept of women and girls. For example, anyone following up on the presenter's invitation to find out more about men's health matters by checking out the WHO's website may be disappointed to discover that a simple search throws up only one relevant result. When it comes to the matter of ensuring gender response health systems and avoiding oppression and discrimination that can exist in society being reproduced in health systems, the WHO's stated priority focuses on achieving gender parity and gender equality in the workplace, thereby increasing the number of women in influential leadership and decision-making roles. The WHO's fact sheets on health matters, which noticeably include suicide, are generally written in a very gender-neutral manner, unless that is they are addressing gender-specific health issues predominantly impacting on women, including things like breast and cervical cancer, and noticeably violence against women and girls. There are, interestingly, no gender-specific male equivalents, such as prostate cancer, or perhaps more controversially, violence against men, which, as we've just heard, is one of the leading causes of morbidity amongst young men. Unlike numerous noticeably gendered initiatives throughout the year, Men's Health Week isn't even an official UN-sponsored campaign. And predictably, the WHO's perspective on the matter of cutting children's genitals is that, depending on the sex of the child, it is either a gross violation of basic human rights, or a practice that has been ongoing for millennia, is steeped in culture and tradition and is relatively good for your health. I could go on, but the final reason I believe it would be unfair to unduly single out one particular individual for particular criticism is that presumably, as she was required to do, the WHO spokesperson on gender equity was simply sticking very much to her employer's policy script. Indeed, in the example you've just heard, almost entirely word for word. All of which brings us to the second of those two major obstacles, being the sometimes overt, sometimes subtle practice of gatekeeping. In human communication terms, social psychologists describe gatekeeping as the process through which ideas and information are filtered. In the 1940s, German psychologist Kurt Lewin coined the term gatekeeping in this context, and was the first to consider how such a concept can be applied in the process of relaying or withholding information from the media to the masses. His theories are still studied by students of mass communication and journalism around the world, and a central tenet of which is that the practice of gatekeeping inevitably requires gatekeepers, who get to influence and to a fair extent dictate what can and can't be said about any particular thing. Gatekeeping theory proposes that communication gatekeepers can and do exist at different levels and areas of any organisation. External gatekeepers can also be highly influential, especially when it comes to matters of morality. And so, once again, in fairness to Evelyn Boy, and speaking from personal experience, presumably she would have risked receiving criticism and unwanted attention from much more senior or influential gatekeepers had she dared wander too far from the official script. And so, in this example, I would propose that intentionally or otherwise, and by their very presence, the WHO's experts on gender equality performed the important function of a gatekeeper in relation to what should or shouldn't be said during a polite, constructive conversation between men and women about men's health. At the very least, she was afforded the opportunity near the start of the discussion to give it a very specific steer towards this sort of negative stereotyping that on a different day might very well have invited the wrath of highly influential gatekeepers, arguing that the inference that a certain section of society are largely responsible for all their own medical ills is in fact an extremely dangerous and unethical example of victim blaming. But thankfully, as it turned out, and as you're about to hear, the WHO's expert on gender equity wasn't the only gatekeeper of significance participating in the discussion.
I saw a comment popping up via hashtag AskWHO regarding the masculinity that Evelyn just talked about. Dr. John Barry made some comments. He say, although many researchers focus on finding ways that masculinity can be bad for health, there is evidence that it is good for health, though this is usually overlooked. Is there any evidence that masculinity can be good for health? Evelyn, would you like to answer to that? Or Dr. Barry?
Yeah, if you don't mind, I can start with that one. I mean, a lot of what, and I don't think this is inconsistent with what Prerna was saying. A lot of the masculinities that I study men who are middle-aged and older typically, and a lot of the masculinities, when you talk to them about what are they trying to do as men, what does being a man mean to them, they're actually tending to focus on more positive ideals, more pro-social ideas. How do they contribute to providing, helping to provide financially for a household? How do they, be good parents? How can they, do things that are actually in a positive way for their communities and so forth? And while they recognize that there are these harmful masculinities, those aren't the things that are really driving them on a day-to-day basis. So we study a lot of and really try to promote healthier masculinities. And those are really not things that we're coming up with as researchers and scholars, but they're talking to men themselves and learning from men and talking about how they actually think about these things. And those are the things that they're promoting as ideals while they recognize that those structures do exist.
I'd also like, if I could come in just to add that I think we tend to overlook when we talk about men's health, we tend to imply that everything men do is terrible when it comes to their health. that men are just hopeless. And I think it's not only untrue, it's unfair as well. And I think there are lots of men who have a very positive approach to their health. We know that when it comes to physical activity, for example, to exercise, that most men in the world actually do enough physical activity to make a positive impact on their health. We know that around the world, generally, most men don't smoke. Most men don't drink too much alcohol. So there's lots of things that men are doing well. And I think we have to build on that. We have to have an approach to men's health that's built on their strengths and what they're doing well and what's positive, not just to write off men as being hopeless. And I think there's a very unfortunate phrase that's been going around in the media, particularly recently, which is toxic masculinity. And I don't like that phrase. I don't think we should use it because it implies that there's something almost inherently wrong with men. And it makes men, if they do reflect on it, it makes them feel ashamed of themselves. It makes them feel guilty. And I think that's not helpful. I think we have to have a much more positive approach.
Now, admittedly, I have deliberately focused on one particular aspect of a 1 hour discussion that particularly helps to highlight the important point that I want to make. But speaking as an equality practitioner with over 2 decades of experience, it is sadly the sort of example that I have witnessed time and time again. Talking about equality-related matters can feel like walking through a bit of a minefield at the best of times, but at least in my experience, never more so than when discussing matters of gender equality, as they apply directly to men. As we heard earlier, we know that pretty much in every country around the entire world, men have significantly higher rates of premature mortality than women, so it's hardly surprising that health inequalities emerged as the first public policy area where it has become relatively acceptable and uncontroversial to talk about inequality of outcomes as they apply directly to men and boys. Education has followed, but sadly, at least in my opinion, public policy makers are never going to be able to come up with, for example, an effective strategy to tackle the phenomenon of male suicide if they insist on focusing so much on the stereotype that men don't talk about their problems, while at the same time consciously ignoring or worse still, even helping to shut down all of the men trying to talk about directly related problems like access to their children, domestic violence, false allegations, discrimination in family courts, discrimination in public service provision, media misandry, cancel culture, and just how toxic and unhelpful pseudoscientific theories like toxic masculinity and male privilege really can be. Of course, rigid gender norms can be harmful to men and women, but stereotypically masculine traits can be extremely positive and important too, as can stereotypically feminine traits like nurturing, caring, and empathy. No one I'm aware of is especially stopping women or non-binary people, or me for that matter, from pursuing the sort of career that involves standing outside in all weathers, wearing a hard hat and building schools, hospitals and public policy maker offices that are predominantly populated by female workers. Of course, individuals ultimately must take personal responsibility for their own well-being, but male and female parents, peers and public policy makers alike also have a vital role to play. And thankfully, WHO gender equity experts do, at the very least, recognise this reality as well.
But it's also important to recognise sometimes the role that women can have in supporting men to approach, either masculinities better, and also, being more emotionally expressive, and encouraging the men in their lives and in their work to be able to display those more positive traits of masculinity. So I'll just leave it at that and hand it back to you.
Sorry, can I add one more point? Yes, Evelyn inspired something for me. So one of the things that I've said a long time in my work is that and hopefully everyone will agree with this, that women are more central to men's health than men are to women's health, meaning that a lot of the positive things in terms of health promotion that men do are often because of the encouragement, relationship, the advice, the counsel, the support that they seek from women in their lives, whether it's as partners, whether it's as mothers, whether it's as daughters, nieces. Women in men's lives, whether it's in doesn't really matter what kind of health issue we're talking about and health behavior we're talking about. We found this in terms of men managing prostate cancer and how they deal with, their changes in their identities and experiences as a result of that, getting men to go to the doctor for preventive care, all these kinds of things women are a bigger part of in the men's health space. So women are definitely very central to men's health and are a very important part of that picture.
Anyway, I'll leave it there for today. As it is Men's Health Week, I'll also leave some links to some helpful resources for anyone thinking about their own or their loved one's health. And as it's also Father's Day, I'll say that if you haven't already signed up with the Centre for Male Psychology, then not only are you missing out on their excellent free monthly magazine, but you'll also miss out on their Father's Day special featuring an insightful interview with the founder of the charity Dad's House, who provides support to single fathers and their children. And finally, just to once again reinforce my point that there really are plenty of positives to be drawn from the full 1-hour discussion linked in the show notes, let's finish with a little bit of constructive advice for men and firstly, gatekeepers of public health policies, from Peter Baker, the Director of Global Action on Men's Health.
I think most men know what they should be doing to improve their health. I mean, there can't be many people who don't know that smoking is bad for you, that you shouldn't drink too much alcohol and you need to take exercise. We don't need to keep on saying those things over and over again because I think most people know them or pretty much know them. I don't think men like to be nagged or kind of told what to do very much. A lot of men get a bit uncomfortable with that. I think what I would say is that it's important for any man who wants to make a change to his health to think about one thing that he can do that's realistic for him, given the circumstances that he finds himself in. One small step, perhaps, in the right direction, and just think about something that you can do that will make your life better and healthier, and try and do that, and try to make it a habit, and try and stick to it as long as possible, and don't get discouraged if it's difficult or you find yourself giving up and going back to the start again. So I would suggest that men decide for themselves what makes sense for them in the context of their own lives, and do their best to have a go at it and make it a habit.
Can't you see it too? There is an elephant in the room.